I know. Let me look. We check with the rules. The rules of the committee allows that a witness may, even though she's not on the video, but if she could hear the question and respond to the question, that she could respond. Let me ask, Congresswoman Sablan, Christina, can you hear me?
Yes, sir. I'm here. I'm on the
All
phone.
right, and I can hear you. Okay. I yield myself 5 minutes for questioning. So, Congresswoman, one of the arguments currently being used against the full implementation of SNAP in the Marianas is that the administrative costs to run the program and the required investments to set up the necessary systems to meet full program compliance. So if the 50 states, District of Columbia, U.S. Virgin Islands, and of course our neighbor territory of Guam can set up and run successful programs, I don't see why our Commonwealth government cannot. So what do you say to this argument that due to some cost and burden, running SNAP in the Marianas is just not practical?
Thank you, Congressman. I am quite familiar with that argument. This notion that full parity is not possible for the territories, for the Marianas in particular, with respect to SNAP, because full compliance is just too complicated, too expensive. And while it's true that full compliance with the program integrity requirements will require significant investment in infrastructure, systems, and people, and while we will have challenges, our lack of compliance right now is not indicative of inability to comply, but I think it points more to the inadequacy of investment thus far to build a system and institutions that are necessary to reach compliance.
All right, so I agree with you, but besides the 3 social welfare programs highlighted today, for example, what programs, if provided full parity and funding, do you think would provide the most benefit to residents in the Marianas? Say you were a member of Congress, what program would you think would be also most beneficial to residents in the Marianas?
Sure. Well, I think temporary assistance for needy families would be a good start. Another in the area of healthcare, our hospital, although it does serve a significant number of low-income patients who do not have access to health insurance and cannot pay for their care, and our hospital is located in a rural area, it does not qualify for the disproportionate share hospital designation or the critical access hospital designation that would protect the hospital from further financial vulnerability. It doesn't qualify for these extra payments. I think that could make a huge difference for.
All right, thank you. Yeah, thank you. And I want to thank you also for your bill that removed the 100% tax on EITC benefits for our people. Thank you very much for that. Dr. Christensen, thank you for your informative testimony. Of course, I often remind my colleagues that denying full program funding to the territories does not provide the savings to federal budget, because quite often our constituents wind up relocating to Hawaii, Florida, or other states where they would receive their full benefits. So, but can you remind us, please, of what occurred during the development of the healthcare reform when House delegates agreed to receive state-like treatment in exchange for our support, only to be told later that we couldn't insist on this agreement because it would jeopardize passage of the ACA bill?
Well, I just remember that the Medicaid issue was one of the hardest issues to get agreement on. As I said in my written testimony, the Senate had wanted to just give us a 30% increase, and really the White House had not had a position on Medicaid. And it was, as I understand it, the very last issue that was resolved in the negotiations for the ACA. It happened with the Hispanic caucus, And it was because one of the issues could not be resolved, one that would provide some coverage for undocumented residents of the United States, that they finally agreed to give us what we did get. It's always a question of funding, but we are American citizens and we are entitled to be treated like American citizens everywhere else in the country. So funding should not be an issue. It's not an issue in Mississippi. It's not an issue in New York. It should not be an issue in the territories. But it was the last thing that really was decided on.
Thank you, Donna. I need to stay within my time, but I do remember that. I do remember that meeting at the White House. I was there when that thing came up. I'm on time, so I now recognize